planet's on fire. It's a real code red. Got us by the balls, we're being slowly bled. All the swollen puppet head, they propagandize big chocolate points and flat outlines. A house full of mirrors, it's a lousy reflection. Run hard left, it's a true direction. Democracy's in trouble, this news isn't fake. Everything we fought for is truly at stake. Border to border, coast to coast, it's time to cue the talent and meet our host. It's a podcast by George. All right, folks, it's showtime.
Hello, hi, how are you? Welcome on in to another podcast by George. Got a little problem with my throat this morning. I had a little cold here the past week or so. Nothing serious, very mild actually, but it seems to have affected my voice today. So I'm going to ask for folks to bear with me a little bit. And we're going to be going, to the podcast by George live line. And we're going to be going straight to the House of Mirrors, as I call it. I talk all the time on the show about climate, war, and healthcare, the 2020 world that we live in. We can be dead in 20 years or less because of climate, dead in 20 minutes or less because of an accidental or purposeful nuclear launch. And of course, connected to both of them and maybe making both of them irrelevant as if you're dead because of healthcare. And I got a couple of friends, folks, and I think I've got a couple of relatives too that are in the ground right now because they couldn't get the healthcare that they needed. Either they were unwilling or unable to access or afford or pay for the health care that they had. And so there's a movement, a call still for Medicare for all and single payer. And we're going to be talking today about someone that's been carrying this flag for years. And I mean, she is just great. I'm going to put my feet up on my desk. I think maybe read the USA Today while she takes the reins here because she's really good, folks. Coming on the lifeline today is Margaret Flowers, Dr. Margaret Flowers. She's a pediatrician and advocate for single-payer healthcare and justice. She's the co-director of Popular Resistance, co-host of Clearing the Fog, and she's a former candidate for the U.S. Senate, I think, on the Green Party. So that's why I wore my green shirt today, folks. And she's on the board of advisors of Physicians for a National Healthcare Program. So let's click a couple of buttons here and say good morning to Dr. Flowers. Hi, Doc.
Good morning, George. Thank you for inviting me on.
Yeah, thanks for coming on the show here. And I mentioned the long struggle, the battle, and it just never seems to end. And this first thing that I wanted to bring up on screen, I thought maybe you could talk or clear, the air a little bit on is the suspension of these Medicaid benefits. Now we've been hearing about this. It's kind of in the weeds here with the wrangling and the debt ceiling and all this type of thing. But how would you encapsulate this?
Well, I think first off, it's important for folks to know that with the public health emergency ending on May 11th, it's estimated, I think, around 14 million people in the United States may lose the Medicaid benefits that they have right now. And then on top of that, the House of Representatives is talking about adding in work requirements so that in order for people to maintain their Medicaid, they would have to prove that they work or check in. And this becomes, for one thing, it only affects a very small minority of people who are on Medicaid, but it creates another barrier to people having access to Medicaid.
Well, and it really gets to the fundamentals of this. And I'm going to play a clip here. And I want you to talk a little bit about the history of Medicaid and Medicare in this country. I'm going to play this clip because I really like it. And it's John Kennedy, for God's sake, going back to the day. And he was seeing through this back then. And a lot of people will find this kind of shocking if they're not historians and they haven't followed this. This was like circa 1960, folks. Watch this.
We do not affect the freedom of choice. You can go to any doctor you want. The doctor and you work out your arrangements with him. We talk about his hospital bills. All these arguments were made against Social Security at the time of Franklin Roosevelt. They're made today. And then other people say, why doesn't the government mind its own business? What is the government's business is the question. This bill serves the public interest. It involves the government because it involves the public welfare. The Constitution of the United States did not make the President or the Congress powerless. It gave them definite responsibilities to advance the general welfare, and that is what we're attempting to do. And then I read that this bill will sap the individual self-reliance of Americans. I can't imagine anything worse or anything better to sap someone's self-reliance than to be sick, alone, broke, or to have saved for a lifetime and put it out in a week, 2 weeks, a month, 2 months. This argument that the government should stay out, that it saps our pioneer stock. I used to hear that argument when we were talking about raising the minimum wage to $1.25.
I'm going to stop that there, but that gets to the point that you were talking about. And there's still this firm belief, and it's the reason employers want to hang on to this health insurance in this country. They want to keep people, they want to keep your nose to the grindstone, folks. They believe that you'll continue to work harder than you should for less than you should get so that you can get these health care benefits. And Kennedy was talking about this back in 1960, Margaret.
Yeah, I mean, it's been more than 100-year struggle in the United States of people advocating for some sort of a national health insurance, which is what Medicare is. It's an excellent model, the original Medicare, not, Medicare is being undermined as well and being privatized, and we can get into that. But, Kennedy got that. And people need to understand that the United States is the only wealthy nation in the world that doesn't have some sort of a universal healthcare system. So these are other capitalist countries around the world that understand that healthcare, he said it's public interest, it's a public good. It's something that everybody needs. And when you have it, you actually, you have a healthier population, you have a more productive population, you have parents that are able to take care of their children. It serves us as a population in so many ways. And, we're continuing to fight for it and continuing to fight the same lies, that he was talking about, where people say, oh, this is the government getting into your healthcare and, and all these scary things that they tell us.
Yeah, and the precedent has been set. Now, I'm a big believer in past precedent. I talk about history on my show a lot, and I'm not a historian, but my God, I know current affairs anyway. I know that other countries have single payer, insurance, health insurance or health coverage, health benefits for their workers. Their people work. And also there's this military component. They think, well, the military has to continue to provide this. It can't be available to everyone because nobody will join the military. Well, these other countries still have militaries. I mean, the questions, they just don't stand the test of time.
No, they absolutely don't. And that was the really sad thing in 2009 during the health reform process, because I was very actively involved in that. I was volunteering as a congressional fellow for Physicians for National Health program at that time. So I was down in Congress, pretty much, several days a week, meeting with staffers, meeting with members of Congress, organizing, briefings and things like that. And, we have three systems in the United States. We have a completely socialized healthcare system, which is our Veterans Administration, where the government owns and operates the system. We have Medicare, traditional Medicare, where the government pays for the healthcare, but people can choose where they go. The providers are not owned by the government. And then we have our privatized private health insurance ripoff system. If we had just had an honest debate and compared the three of those, we would have seen that the socialized system and the Medicare system are far superior to our privatized system.
Well, we've got some people joining the broadcast now. I want to get off. This is kind of the shocker that everybody needs reminded of. And it's what I use to start the show with, to promote it when I send out the little advisories. Look at this. This is the insult to the injury. This is a nation that's spending $1 trillion on these damn bombs and missiles, annually renewable every year, to blow people up around the planet. And then we've got these health insurance CEOs that making more than $20 million a year in 2022. And this is the exact listing. I'm going to read this because this is just for the people in audio. Joseph Zabretsky Molina, $22,131,000 last year. Karen Lynch, CVS, $317,000 last year. David Cordani, Cigna, $20,965,000 last year. Gail Bordeaux, Anthem, $20,000, $20 million, 931,000. These are hard numbers for me to read. I don't read big numbers like this very often, folks. Andrew Whitty of United, I don't know what that is exactly, $20,865,000. And last year, we were in a pandemic. I mean, you talk about a house of mirrors. You talk about insult to injury. This is it, doctor.
Yeah, and you know what's the interesting thing now is after the Affordable Care Act, which has really driven more privatization of our public insurances, our Medicaid, and our Medicare, for the top 5 health insurance corporations in the United States, more than half of their revenue is coming from the government through the Medicare, through the Medicaid system, through these public programs. And, you know, that money is, well, for Medicaid, some of them are taking as much as 40 to 50% of what they get for administrative costs instead of spending that on actual health care for people. It's just a complete ripoff for the public.
And, you know, the thing that gets me about it is we're talking about money and dollars here. And we're talking about human lives. We're talking about people that could and would have been saved. And this next slide gets to it. I have this in my open. This is, I'll never forget this as long as I live. The lack of universal health care cost 300,000 American lives in the pandemic, study shows. Now, this is in USA Today, folks. This isn't in some ookie kabuki far left wing media that I'm citing here. People without insurance often don't have primary care doctors and are more likely to suffer from the types of preventable disease that exacerbated COVID's risks, the study showed. More than 330,000 Americans could have been saved during COVID-19 pandemic if the United States operated under a universal healthcare system. Nearly 1/3 of the total COVID-related deaths, according to a recent study. This just cannot be stated enough. The study, published in Proceedings of the National Academy of Sciences, USA, last week found that universal healthcare would have helped address underlying and pre-existing conditions that contributed to the COVID-related deaths, ultimately saving over 338,000 lives between the start of the pandemic and mid-March 2022. And my voice is breaking a little bit there. But the point that I make, Dr. Flowers, to people is I cite this million dead civilians because of the Iraq war all the time. Get a visual on this. I mean, you just think about stacking bodies, 338,000. Think about if one of them was your spouse, your brother, your sister, your child, for God's sake. 338,000 dead in the ground because we're not doing what countries in Europe are doing.
Right. I think that's about the population of the state of Montana, you know,
Wow.
entire state worth of people, you know, and this is the thing. I mean, we also know that we have tens of thousands of people who die in the United States every year just because they don't have health insurance, something that doesn't happen, you know, in other countries. And our system, you know, I often use this example to just show how perverse our system is. So Medicare is a public health insurance for the elderly and people with chronic illnesses. So hypertension, high blood pressure in the United States, you know, we call it the silent killer. Because people can't get, you know, regular primary care, or even if they do, affording their prescriptions becomes another barrier to care. We have people in their 40s who are getting end-stage kidney disease, who have strokes because of high blood pressure. And so once that happens, now we'll take care of you on Medicare. You know, you can get your dialysis or get your rehabilitation. But these people now in their 40s are impacted for life. And these are simple, preventable types of conditions, you know, that we could be addressing. And it just, to me, it's such a perversion of what health is about and what we should be doing.
Well, and what should we be doing? If you listen to Joe Biden, he'll be talking about the Affordable Care Act. Republicans have nothing. Trump had a big nothing burger when it came to a national health care program of some type, but they'll tell you the people need access to health care. Well, the Affordable Care Act gives you access, but I kind of look at it in terms of $6,000. You're either going to pay $6,000 in premiums per year, or you're going to have a $6,000 deductible before you can access this system. And that precludes a lot of people, and they die, for God's sake. As I mentioned at the onset, I got a couple of friends, and they kind of fall into these categories that I know you're familiar with. One guy, He was a staunch Republican, kind of a tight-fisted, money guy. Didn't want to spend any money even on himself and his own health care. He wouldn't patronize anything that was called Obamacare, for God's sake. And so he didn't get his blood pressure medicine. The dude died. And I had another friend, a woman, she had I know it was a curable form of cancer, or at least manageable, had no health care. The $6,000 was a huge hurdle for them. They fritzed around. They didn't get it. She's gone, Margaret. I mean, I tell people, dying will ruin your day. And my friends' lives are ruined forever because of this.
Yeah, and that's the amazing thing, is that with the Affordable Care Act, the United States government codified into law a tiered system. So, you can get the platinum plan or the gold plan or the silver plan. When what we need is a universal system where everybody gets, what they need. Basically, that's what happens in other countries. But it also sold people these private insurance plans, telling them that they would have health care. And as you said, they have to pay out thousands of dollars before that even happens. So I hear stories all the time of people who make decisions, they get cancer and it's like, okay, do I get chemotherapy and get treatment for this? Or do I make sure that when I die, my family has a house to live in? Or do I make sure that my children can go to college? And so people are actively choosing not to seek care for these types of conditions out of fear. And this doesn't happen anywhere else. It's not a financial decision in any other country of whether you get care or not. It's just, I need to go see the doctor, and you go.
It's
the cruelest. It's cruelest form of rationing. People always say, "Oh, they ration healthcare in other countries." Well, this is, how cruel can you be? It's based on whether you can pay or not what your needs are.
And it's the house of mirrors. I started off saying, to me, what do I want? What do I want from my government? It's kind of what Kennedy was talking about there. These are the types of services that I want from my government. I want my government with the collective taxes, although the Sanders supporters will tell you that that's not necessarily how this thing works, but I want them using our collective money to do collective good, not to blow people up around the world, not to do these heinous, terrible things. Keep people alive, feed people. The government should be doing these positive things, doing things like a national health care program. But we're told that we can't do it, that we can't afford it. And I want to talk about that a little bit, but I also wanted to bring this up on screen here because Indie Left Media has joined, and they want us to think about the World Press Freedom Day 2023. Yeah, that's happening. They've got a big event out on the East Coast, Washington and New York City and places like that today. And the media plays a role in this also. The media does cover these types of things. Here's another article. This was out of NPR. Again, a real jaw dropper. More than 42% of the 9.5 million people diagnosed with cancer from 2000 to 2012 drained their life's assets within 2 years, according to a study published last year in the American Journal of Medicine. Cancer patients are 2.65 times more likely to file for bankruptcy than those without cancer. And bankruptcy puts them at a higher risk for early death. Yeah, when you're bankrupt and despondent and mentally depressed, you're more likely to die. My God, that's the insult to injury. That's what's happening with cancer in the country. And we're seeing cancer rates not decline the way that they should. Our overall health care, the benefit that we get from the services that we do have are declining, Dr. Flowers. I know you watch that closely.
And this is the thing, in the United States, people are always talking about, oh, well, if we had a national health system, what would that do to innovation? In the United States, the health system is all about profit. So you've got the private insurance corporations that charge premiums as high as they can. They, put deductibles and other obstacles in place. They deny care, even when they're supposed to cover it. When they get audited, we find that they're denying care that they, under their own policies, recognize they should be covering. Pharmaceutical corporations are making medications not based on what our needs are, but they're making it based on what is easy. We'll tweak the chemical a little bit, we'll give it a new name, we'll push it out there, we'll raise the price, patent it. And so our whole health system is designed for profit and not about, well, how do we address the public health crises that we have? How do we deal with cancer? Cancer is a huge moneymaker for institutions. And so this is the thing. If we had a national health system of some sort, we could look at what the needs are, what our highest priorities. We could use our public dollars, which actually most of the innovation comes out of publicly financed studies to begin with through the National Institutes of Health or other universities. We could be looking at what the needs are and prioritizing it and investing and really going after the health problems that we have in the country and raising the level of health for everybody. That's what you see in a system that prioritizes health.
Yeah, it's priorities, and it's about the cost of this. Now, as I mentioned earlier, universal health care could have saved more than 330,000 U.S. lives during COVID. Okay. To me, that gives you the cost to benefit ratio. That's all that you need. These lives could have been saved. But again, think about that $1 trillion annually renewable that we're spending on the military. And I wanted to talk to you specifically about this because I was a Bernie Sanders supporter early on, and I remember in the last presidential debates, Joe Biden was on the podium with Bernie, and Joe's retort on universal health care is, well, how can we afford it? Well, that's laughable when you consider what we're spending on the military as an example, and on corporation subsidies and tax breaks and all that type of thing. But I thought, God, Bernie will jump to the fore here. He'll be able to explain to people a very simple concept. This actually saves money. Medicare for All does. And on an individual basis, because everybody tends to think of themselves first and foremost, and that's just the way we are as human animals. True, you will see a slight increase in your taxes probably because it's being administered by the government, but you will be paying far less on a private basis for your deductibles and premiums and type of thing. So it's a win-win. But Bernie blew it. I mean, he didn't answer it like that. I'm like, what the hell, Bernie? Come on, step up to the plate here. You've been campaigning on this for 7 years, for God's sake. But is my explanation basically correct?
Yeah, I mean, across the board, different institutions have looked at a single payer type of system, a Medicare for all type of system. And whether they come from a conservative or, a more progressive, they all find the same thing, that it would actually save us hundreds of billions of dollars a year nationally on our healthcare costs if we went to some sort of a national system. And again, right now we have a very regressive financing of our healthcare. We're one of the most regressive in the world. So if you make less money, you're spending a higher proportion of your income on healthcare. If we flipped that and made it a progressive financing, then there would be, people that would not see an increase in their healthcare costs. And maybe those who are wealthier might be spending a little bit more, but, they're going to be okay. They're still going to be able to put food on the table. So we're not too worried about them. But imagine if you didn't have to worry about your healthcare. If, you didn't have to worry if you were, people don't get in ambulances. They don't want to go to the emergency room because they're afraid of what that's going to do to them financially. And so many people in the US are in a precarious situation anyway.
Yes.
They don't, I think, what is it? It's a huge proportion of the population that doesn't even have like $500 or $1,000 in their savings accounts, to afford an emergency.
And
so we wouldn't see that.
And this is an emergency, and children are going to bed hungry all over this country. It's easy to, if you're not in that circumstance, to just not think about that. But there are people there. And speaking of that, I want to talk a little bit more about this Medicaid. Now, this is Mary Knox, and she's a frequent viewer of the shows. I like to refer to my associate editor or something. But she had this, we talked about, I mentioned how they're wanting to means test this Medicaid stuff. Make sure that you've got a job, that you're working, that you're earning your Medicaid. Well, she says, I noticed this as well, George. Bernie also did not point out the savings for the federal government. Okay, that's not the comment I wanted. It's this one. She says, now in Iowa, if you have Medicaid, Iowa will take any savings or assets when you die. Have you heard that? Is that true?
Well, if you go into like long-term care and you have Medicaid, you have to spend down all of your assets before they'll cover it. So you talked earlier about people staying in jobs. That absolutely happens. People get divorces so that they can still be eligible for Medicaid, or they stay in abusive relationships because they can get insurance, or like you said, they stay in the military for the healthcare. People have to understand that our life choices are being shaped by this healthcare system in ways that are detrimental to people.
Yeah. And it sucks. Let me bring this up on. I mean, I hate that I got a doctor on here, and but talk about
Yeah.
explain this chart for us.
Yeah, so this chart looks at comparable wealthy nations and looks at how much they're spending on healthcare each year and the life expectancy in that country. And I'm sure you're aware that in the United States, our life expectancy has been falling for the last few years, and that started before the COVID-19 pandemic. So if you look on the life expectancy bars on the left-hand side of that chart, you see that the United States has a lower life expectancy than many of these countries. But then look at our spending, our per person spending, is twice as much as what the average is. So we're spending more than enough right now in the United States on healthcare to cover every single person and cover everything that they need. We're talking about a system that's not what I call body part medicine. Right now, unfortunately, Medicare has been really undermined. So it doesn't cover your eyeglasses or your vision, your hearing or mental health or so things like that. We've got to understand that there's a whole body and we should be treating everything, that body needs. And so under a Medicare for all system, it would be comprehensive. And we're actually pushing for long-term care as well. That should be included. People should not, be in this terrible situation where there are stories about, people who have a spouse who's in long-term care, and because they have to spend everything down, the one who's not in long-term care is homeless, or suffering or food insecure.
Yes.
It's cruel. It's so cruel.
Medical bankruptcy. And I did a show on homelessness not too long ago. And the advocate, that's exactly right. That's what they were telling me, that these healthcare expenses have a lot to do with why people are on the street. So if you're on the borderline yourself, pay attention to this. And if you don't like homelessness, you don't like seeing all the homeless people, God, I hear that all the time. Again, they're not there because they want to be, but regardless, do something about healthcare and we'll help the homelessness situation. Well, let me bring this up on screen before we lose the good doctor here, because this is her organization here. Now, this is the Physicians for a National Health Program, PNHP. Physicians to Congress passed Medicare for All to solve America's coverage and hospital funding crises. As millions of Americans are set to lose insurance, doctors point to Medicare for All as the only way to guarantee coverage and stabilize hospital funding during a public health crisis. Physicians for the National Health Care Program, a 25,000-member nonprofit research and education organization, called on congressional leaders to pass a single-payer national health system before the next public health emergency. So I want to ask you there, doctor, because Medicare costs are rising for individuals. It's not free. Everybody realizes that. You hear the terms Medicare for All and single payer kind of bandied about. What are you advocating for? Is it Medicare for All or single payer, or are they the same thing in your mind?
Well, Medicare for All is a type of single payer healthcare system. Single payer just means that there's a single public fund that's used to pay for something. And there's two different ways, as I talked earlier in the show, about how to do that. We could actually create a national health system like the United Kingdom has, where the government owns the hospitals, the offices, employs the physicians, nurses, all the people that work in our healthcare system. Or we could do a Medicare for All system, which is where really the government becomes a national health insurance. So the government has the money in a fund and they pay for the hospitals, would get a global budget each month. They would get a certain amount of money to cover their costs. So one thing that would do is, right now, nurses spend so much time just checking off little boxes. I gave one aspirin. I used one alcohol wipe, so that they can, charge for everything. That would go away under a global budget. People working in the hospital just focus on what their patients need and not all this, keeping track of little things so they can charge for it. Physicians would just submit their bills to a single entity and get paid. Medicare pays very quickly and pretty easily compared to what they have to deal with fighting private insurance companies to get paid. And people would be able to choose where they want to go. So the practices would still be the same. The hospitals would still be the same. But really importantly, we're losing our hospitals. We have been losing them for some time now, particularly in rural areas and in low-income areas of cities. They're just, these private entities come in and run them to the ground, drive them into bankruptcy, or they sell them off because they're more lucrative, in cities as retail space or condominiums. And so we have a real crisis in our country of not enough hospital beds and people having to travel long distances to get care. So that would go away. we'd have the fund to be able to pay and maintain that infrastructure that we need. So it's lifelong, national, everything is covered. You don't have to pay at the time of service. You just go and get the care that you need. And physicians are free to practice. We haven't talked about that, but the current system is really hurting our physicians as well.
Yeah. Let's talk a little more about rural places, because I'm here in Iowa, and I want to tell you something, folks. Once you get out in the boonies, particularly once you head south of Des Moines, it seems like, I mean, the land gets worse. I mean, I don't want to insult people in Missouri, but that's kind of what it reminds me of. Well, you go to these small towns and the buildings, I mean, they're out of the 1940s and 1950s. Nothing has been updated. Nothing has been modernized. There's no tech in these communities. They don't have access to broadband and that type of thing. The one shining place on the hill for some of these small rural communities is their healthcare facility. It's their rural hospital. Well, when you close those towns, man, they lose a lot, doctor. I mean, they really do.
For some communities, that's the only way they have access to an ATM, a place to eat sometimes. It's not just the jobs in the community and the health of the people in the community, but it really does provide those services that they need. But there are studies showing that when hospitals close down, mortality rates go up because people have to travel farther, or they just simply can't get there. Ambulances have to travel farther. So it has a huge impact. I think in 1975, we had about 1.5 million hospital beds and about 220 million population. Now we have fewer than 1 million hospital beds, but our population is like 330 million people now. So that just gives you an idea of this crisis that we have.
Well, let's talk a little bit about the job component, that aspect of it, because that gets thrown around a lot. I hear, for instance, well, we can't go off oil because all of those jobs will be lost in the oil industry. I'm like, bullshit. Those people in the oil industry, those CEOs and those boards of directors, what they're going to do is get busy and try to find alternative sources to keep those profits up. It'll keep whirling right along. Those people in those industries serving oil and coal, they'll go to work in greener industries. I mean, I know that will happen. The military, they say, well, we can't get rid of these, 850 military bases ringing our planet because all of these military personnel will be put out of work. I'm kind of like, find something else for them to do. I'm not really too concerned about
They're
the
building infrastructure in other countries. They could
Yes.
be building infrastructure here. We need
road and belt initiatives. Yeah, China's doing it. I mean, a perfect example of what could and should be done around the world and in this country. Well, the same thing here with the private insurers. And I'm here in the heartland. I mean, Des Moines, I think, is the second largest insurer next to the Hartford in the country. Not necessarily health, but all of these insurance agencies. What are we going to do with all of these workers? Well, this will just be moved around. These people aren't going to be put out of work. They're not going to lose their livelihoods and their homes and that type of thing if we go to a Medicare for all system. Has this analysis been done?
Yeah, and actually, I think National Nurses United did a study and found that it would actually increase jobs because of the economic benefits that we would see from having a national health and insurance, where people are no longer going bankrupt or struggling financially. They can actually use those funds to buy things that they need, which there's a lot of need out there. But under this, so we have a shortage of direct care providers, physicians and nurses. And part of this is that the way the system is designed right now, it's pushing people out. They just get fed up with it because you're constantly fighting with private health insurers who are telling you what you can and can't do, and not based on what the patients need. It's based on what they can get away with. So if we had a national health system, we do need administrators to run it. So people would be, employed doing that. But all of these direct care providers who have left and gone into administrative positions could come back in and actually provide care for people. So there's a lot of hiring that we would need to do on that end. We need more primary care physicians, where we have a real shortage of that here in the United States. So overall, it would be a benefit in that way as well. And we're calling for a just transition, in the legislation, that people who are displaced by the system would be prioritized to be hired back into it, or they would receive salary support and training to go into, another field.
Yeah. And then combine into the math, for instance, during COVID, there'd be 330,000 people that didn't die because of it. I mean, if you're looking for a tiebreaker, that's a hell of a tiebreaker, folks. You'll be alive. Okay, we're gonna lose a doc here pretty soon, but I wanted to have her, and I'm just gonna throw this over and let you talk about. This is a big one with my wife in particular. She wants you to talk about this Medicare Advantage, because this is being inundated on our national airwaves, and everybody, they're having seminars and meetings. I get this stuff in my mail. Medicare Advantage. Talk about this, doctor.
Yeah, so this is, the health insurance corporations finding another way to be a predator in our system is through the privatization of Medicare. And many people are not aware of Medicare Advantage. It has this name that sounds really great, Medicare Advantage, but it's a complete scam. Instead of having traditional Medicare that we've always had, if you get scammed into one of these Medicare Advantage plans, and they're very good at, they even do things that are illegal. Like I know my ex-mother-in-law in New York had a traditional plan, and then in her senior center, this nice guy came in and talked her into buying this Medicare Advantage plan, and we could not talk her out of it. She was so convinced that what he had told her was true. What these plans are is they're like private health insurance, so they can charge deductibles and copays, that traditional Medicare wouldn't charge. They limit, what you can get, just like a private health insurance plan does. And the studies have shown this. They do something called cherry picking and lemon dropping. So they go to places where they can enroll healthy seniors. And then if the senior gets sick, they find ways to incentivize them to leave the plan and go back to traditional Medicare. So they're taking a huge amount of money out of our healthcare system to basically cover people that don't really need healthcare and then drop them when they do need it. So people, they do sell these things by saying, oh, well, you're going to get vision care, you're going to get hearing. That's great. But people need to understand overall, if you have a serious problem and you're in one of these Medicare Advantage plans, you're not going to get the care that you need. And that's what that study that you brought up, showed.
Well, it's insult to injury. We've talked about so often. I've heard it promoted where, yeah, if you get Medicare Advantage, you'll be able to get free yoga classes. You'll be able to
sneakers, right? Yeah,
you can do water aerobics. I'm like, what? That's con man stuff, for God's sake. And that,
that's how they attract the healthy seniors, and they get more money from the government for their plans than the traditional Medicare does. So they're undermining our traditional Medicare system as well.
Yes. And I wanted to emphasize that, folks, because it goes to the question I ask all the time on my show. Are they too dumb, or are they in on it? No, they're in on it. They want to privatize Medicare. And this is a first step. It's a big first step. This Medicare Advantage stuff is wildly successful, Doctor.
Well, and people also need to know about this new thing. It started under Trump. It's called ACOs. ACO Reach is what they call it right now. And so this came out of the Affordable Care Act as well. They created this Center for Innovation in Medicare and Medicaid, which was basically, how do we privatize this? And it was led by this woman, Liz Fowler, who was also an architect, former insurance senior vice president, architect of the ACA as well. In this new ACO program, seniors are being put into private Medicare plans, and they don't even know it, because it's the providers now that are being drawn into these plans. And so if you are going to a particular provider, you're now in this private Medicare plan, and you're going to, have the problems and obstacles to getting care that they have. So this is really nefarious. And there was a lot of pushback against it when Biden came into office. He just repackaged it and continued it anyway. So that's another thing that people need to know about and should be letting their members of Congress know. We don't support this.
God, it galls me, because it's the old, don't look at my right hand, look at what my left hand's. Yeah. And my left hand's taking the money, folks. I mean, that's what it's all about. Okay. Last viewer question here. I want to get this up for the doctor here. Mary Knox says, nursing home closures have left rural Iowans scrambling, trying to relocate and find openings. She says Iowa has too many nursing home closings and providing subpar care to the elderly. God, we're all headed there, folks. What was the largest demographic in America? The boomers. I mean, again, it's hard to believe that we're not paying attention to this. There is a worker shortage. Now, she wants to know, is this due to low reimbursement or greed, or maybe both?
Yeah, I mean, long-term care should be considered part of our healthcare system. It should be covered for everybody in a public system. And we know that public long-term care facilities have better outcomes than the privatized ones do, because they don't have that profit motive where have the least staff that you can have, the least things on hand that you need. under the, the private model, they use a business type of approach to it. Under a public one, it's just really about care. But the fact that long-term care is under Medicaid doesn't pay well, that has really undermined our long-term care facilities. And then you have these private, and that's the thing with the ACO REACH as well. These are like investment corporations. They're not healthcare corporations. They're just investors, capital, whatever, institutions investing into these things. They don't care about the health. They just care about how much money they can get out of it. So that's really undermining our long-term, and actually hospice too, unfortunately.
Yes.
Care facilities. They're being, they're now, the predators are after them as well.
Yeah, and lots of us are going to need these services, folks. And don't let anybody tell you that we can't do it. We can afford it, certainly. This $1 trillion a year I mentioned in the military budget. We got bombs that cost $1 million a piece, folks. We can afford this. It's a matter of choice as far as expenditures are concerned. And then you think, well, are we capable of doing this? My God, we're developing a space force. I mean, you can't even understand what they're doing with AI. We're completely technically capable of providing a healthcare service that's better than what they've got in these European nations, and that chart that we saw on screen earlier. Well, folks, we got to let her go because she's busy. Of course, she is a doctor. She's on the board of advisors of Physicians for a National Healthcare Programs. It's Dr. Margaret Flowers. And I'll give you last word, Doc. You've been very kind to spend time with us here today. How would you like to wrap this up, or any advisory that you would like to give to people, or maybe point them towards your websites or causes or whatever? It's yours. Yeah.
Thank you for that. Yeah. The public opinion is with us. The majority of people in the United States want a national health insurance, a national Medicare for all, and it needs to be at the national level so everybody can get the same health care across the country, wherever you are, wherever you go. We need to be pushing for that, and we just had legislation reintroduced in Congress on this. So reach out to your member of Congress. If you want to know more about it, go to the PNHP website, pnhp.org. There's lots of materials there, including, just basic, what is it that we're talking about? There's ways to take action. And then, just recognize that healthcare impacts all of us. And so whatever your group is, church, school, community group, organizations, we need to be talking about this and making this part of our push for the change that we need in this country. Because the empire's falling. We get to decide what's going to rise up out of the ashes, and hopefully it's going to be, a system that supports the needs of people, whether it's housing, healthcare, education, you name it.
That's well said.
So thanks.
Oh, yeah. And we'll circle back because this is something that we need. It's something that we've got to have. We've got to change our consciousness in this country. I was reminded of what Dennis Kucinich said recently, the former congressman. We got to decide who we are, folks. Is this the type of thing that we want to do? Do we want to help ourselves, help our neighbors, our friends with their health care, keep them alive, keep them healthy? Or do we want to destroy the earth? I mean, we got to decide, and this is a big part of it. Dr. Flowers, thanks again for coming on Podcast by George.
Thank you.
And folks, I'm going to leave with this, like I always do. I tell people to go to podcastbygeorge.com and go to Dr. Flowers' site, first of all. There's a lot of great stuff there because we're not helpless. There are things that we can do. And you can follow her on Twitter at mflowers8. Do that as well. But after you do that, go to podcastbygeorge.com. Select a platform where you'd like to follow my shows, where you'd like to see us in video. It's on Facebook and on YouTube. You just click those little buttons and it'll sign you up there, and ring the notification bell on YouTube if you're there to help beat the algorithm. And then, of course, if you like the audio here, if you want to listen to this while you're out taking a walk, riding your bike, driving in your car, whatever the case might be, you can check us out by clicking the badge for the audio platforms, including iTunes, Spotify, the iHeartRadio app, Amazon Music, all of those places. But that's going to do it, folks. That's going to wrap it up. That's all there is. And there ain't no more. That's another podcast by George.